Hello, this is Dr. Steele. Today I want to talk to you about a subject that is extremely important. I know that as we get older, we want to find the magic formula to live longer and feel younger. And there are different things out there in the market that promise that. And all of us know that can exercise, what we eat, and how we move are going to have a great impact. Just like taking the right supplements, like vitamin D, that is important for longevity. And also being happy and having a good support amongst your family and friends also prolongs life. It makes you feel good living your life. But we have come scientifically, not only with diet and exercise, knowing just like the vitamin D, there are certain supplements, not supplements, certain micronutrients that we do eat and we are exposed to, but sometimes it's not enough. And the reason I'm saying this is because, again, I'm talking about the very small, your cells. Your cells need to have the raw material to produce what they produce, vis-a-vis, that is, proteins, hormones, or be able to metabolize our nutrients in a way that those cells can function. So it's important to recognize that we're moving towards not only AI, artificial intelligence, we're also in medicine, we're moving to the supplement of the internal juices that we're no longer producing, or making sure the structures that are not functioning correctly, somehow we are affecting them for us to be healthier for longer. Knowing that we're not eternal, you're not eternal, I'm not eternal, but what is it that we can do, or can we contact to help us supplement or help us realize that there are things that we're missing? Besides cancers and infections, cardiovascular disease is important because what we eat is who we become. And it's important to recognize that the food that we eat, if they're after 50 especially, which I'm already there beyond that, if we eat things that are very sticky, like a lot of fats, or very sugary, like honey, or a lot of sugars, those things are going to, it's going to sting in our vessels. When we're young, we can actually help our body get rid of that excess. But as we get older, our body's not equipped to do that. As well as remember this, you and I, at this moment, we're exposed to cancer cells. Our body's producing them. But since our body's older, our immune system is not as new as it used to be. We're more prone to get cancer because those cells that used to neutralize those cancers are no longer as effective as they used to be. So eating carcinogens or breathing or being exposed to them when we're young, if we're lucky enough to have a good immune system, it's not going to affect us that much unless we have a genetic disorder or something that is not working right. My point is, it's important not just only to think about medications as a solution. It's an it's an overall, there's a lot of things that we need to consider. But not everybody, but sometimes all of us focus on one thing. Oh, it's the diet, it's the lack of exercise, it's the lack of medication, it's the lack of supplement, it's the lack of relaxation, it's the lack of not having the right mindset. It's like all of those things need to be addressed. So my message for today, there's always a way to live longer and feel younger. But again, it takes a team effort to do that. So I want you to realize that as we get older with this information that we have all over the place, we need to bring that information into one specific plan. And you need to find a provider or a doctor that can help you do that. And that's my message for today. Take care. Talk to you soon.